Most of the people with sciatica are doing what feels good for 10 minutes and what makes them feel worse for the next 10 hours. The issue may not be the tight muscles. The issue may be that the sciatic nerve is getting irritated because your lower back isn't tolerating some movements very well. In this video, I will show you the first movement I test when patients come with pain that runs from their lower back into the buttock and down their leg. Most importantly, how to tell if it's actually helping or making things worse. Hi, I am Rida, the doctor of physical therapy. One of the biggest mistakes I see people making is treating every case of sciatica the same way. However, it is not, because some may benefit with bending forward while others may benefit with bending backwards. Some may need more motion while others may need to calm things down first. That is why I don't hand the same advice to every patient. But there is one thing I test in all of these cases, because when it's the right match, it can calm things down fast. Before we move on to the exercise, let's clear one thing up first. Sciatica is not a single diagnosis. It is a description of symptoms like pain, tingling, numbness, or burning that travels from your lower back into the glute and down the leg. Most people assume the answer is stretching those hamstrings or piriformis. Sometimes that may help. However, the real issue is that the sciatic nerve is getting irritated because of how your lower back is loading the nerve. Here is the key concept I tell my patients. The pain that travels from your lower back into the buttock and farther down the leg into the foot is usually not a good sign. However, the pain that pulls towards the glute and towards the lower back is considered a good sign. It is called centralization. The goal is not to chase the biggest stretch. The goal is to find the right movement that makes the pain less intense, less frequent, or less widespread. For many people, especially those who feel worse after sitting, driving, or bending forward, the first movement I test is a gentle back extension. Let's see how to do it. Before you start, ask these three simple questions to yourself. Where is the pain right now? How strong is the pain on the scale of 0 to 10? 0 being the least and 10 being the most. Is the pain staying above the knee or is it going below the knee? Now first, let's come down to your stomach. Stay here for about 30 to 60 seconds and ask yourself, how is it feeling? Breathe normally while staying here. After that, if this feels okay, let's move on and drop onto your elbows. Elbows being staying underneath your shoulders. Breathe normally. Don't try to force yourself while being in this position for 10 to 20 seconds. If this still feels comfortable, let's move on to the next step, which is place your arms underneath your shoulders and extend your spine while keeping your hips heavy on the mat. Breathe normally. Slowly press down and come up again. Do this for 2 to 3 times. And while performing this, ask yourself, is the pain still less? Is the intensity of the pain decreasing? Is the intensity increasing? Is it localized? If the pain is becoming worse, please stop performing the exercise. While performing the exercise, if the pain pulled towards your buttock or your lower back, or If the pain became less intense or you felt better after doing even a few repetitions, it is an encouraging sign. On the other hand, if the pain traveled farther down your leg or the pain intensity increased or you felt worse even after doing a few repetitions, this probably isn't the right exercise for you today. Stop pushing even if you feel worse after doing a few repetitions. If these press ups helped, don't overdo them. The good starting point is 10 repetitions every 2 to 3 hours for a day or two. Slow and controlled movements help much better than pushing your body into a big range of motion. Remember, the goal is not to chase the big stretch. It is simply to improve the symptoms. This exercise is not appropriate for everyone. If you have progressive weakness, major numbness, loss of bowel and bladder control, and severe pain that is rapidly worsening, don't treat the symptoms with exercises you have seen online. These symptoms need immediate medical assessment. Just because it helps someone else online doesn't mean you keep pushing through the pain even though it's making you feel worse. Your body decides whether an exercise is right, not the internet. Before you leave, here are few common mistakes to avoid. Stretching aggressively into the pain. Following random sciatica fixes even without testing. Judging success by how hard the stretch feels. Sitting for prolonged hours is making the sciatica worse. If you found this video helpful, please give a video a like and subscribe to Redynamics for evidence-based health